Achieving real development outcomes on the ground is a complex task. But when it comes time to protecting people from malaria, it's quite straightforward. Malaria is preventable and it's treatable. We know it works. So why are so many people still dying from this dreadful disease? Last week, the World Bank released its 2010 World Development Indicators. They showed that there were still 850,000 malaria-related deaths in 2008. It takes a high toll on households and healthcare systems, undermining overall development. Poor people are most vulnerable. They have less access to services, information, and protective net. This is a bed net. This is what works. And the good news has been that there's been progress in scaling up in the use of treated bed nets among children. Use of bed nets among children rose from 2% in 2000 to 22% in 2008 across Africa. In 2007, Rwanda could report that it had cut malaria-related deaths by 67% from 2001 to 2006. It also increased health center utilization rate to over 70%. In Zambia, 62% of households now have at least one treated net, and 66% of pregnant women receive preventative treatment. This is 3 times more than the numbers in 2004. But this is far from enough. We can and must take steps to save the lives of thousands of people, many of them children. 2 years ago, UN Secretary General Ban Ki-moon called for everyone at risk of contracting malaria to receive a life-saving bed net by 2010. We have only 8 months left to meet this target. We have delivered 200 million mosquito bed nets across sub-Saharan Africa. 100 million more bed nets are being produced and delivered. But we still need 50 million more bed nets to protect all the people at risk by the end of this year. The World Bank is one of the 3 largest funders of the fight against malaria. Today, the World Bank is mobilizing $200 million more to fund the production and distribution of 25 million extra bed nets, thereby closing half of the existing gap. This amount is part of the $1.1 billion commitment the World Bank made in September of 2008 when we launched the second phase of the booster program to help African countries to expand their malaria prevention, care, and treatment programs. Now others need to step up their efforts too. I encourage countries to prioritize their IDA resources to defeat malaria. The money we're making available today will support malaria prevention efforts in the Democratic Republic of Congo, Ethiopia, Ghana, Kenya, Mozambique, Sierra Leone, and Zambia. These countries are among the 31 hardest hit by malaria. They are also where we can quickly build on our existing health portfolio. We're only 5 years away from the target date to achieve the Millennium Development Goals. We made progress on several of the goals, but the combination of the food, the fuel, the financial crisis have slowed and even reversed some of the gains. So overcoming malaria would be an excellent way of making a key contribution to reducing child and maternal mortality. Here are some of the things that we still need to do. The international community is heeding the call to fund and produce the bed nets and drug treatments, but we're not doing enough to deliver the bed nets and treat all 350 million people at risk. We must increase the number of African children with timely and effective access to malarial treatment. Prompt treatment within 24 hours of the onset of fever is crucial to prevent life-threatening complications. And countries' leadership is essential. I'm extremely encouraged that African leaders have joined forces under the Africa Leaders Malaria Alliance. The strong commitment and political will of African leaders is vital to overcoming malaria.